I got to introduce her this morning because we have been, along with Jeannie Brzezinski at CDHS, side by side planning this event for the last, I think, 6 months or more? Yeah. So I just want to again thank both of them for all of the work getting this put together. I'd like to introduce Ms. Shannon Bryan. Ms. Bryan is a substance use policy and practice administrator for the Division of Child Welfare within the Colorado Department of Human Services. In this role, she leads strategic process and efforts to better understand and address the impact of substance use on the well-being of children and families. In partnership with state, county, and community stakeholders, Shannon works to improve outcomes for children, youth, and families across the Colorado region. So, Ms. Shannon, I will turn it over to you.
I'm going to try and disconnect this from. I feel like this is better because I don't know if you can really see me from behind the podium. I'm a little short. We're just double checking our technology again. I don't know if you guys have noticed, but this is not quite our strength, but we're learning. So thank you guys for having me here today. I am really happy to be here. I think addressing substance use is probably one of the most important topics that any community can talk about. It's a huge issue, right? It impacts so many parts of our lives, so many people in such a deep way. And it's also really scary because lives are on the line, but it's also this monolithic thing. And how are we supposed to make a difference? How are we supposed to make an impact when it's so big? So I just really think it's amazing that you all are here, that you all want to engage in this and are all curious about this topic and supporting your community. I'm not here to talk about CDHS or child welfare. There are other presentations tomorrow that are going to be about that. So really, I'm just here to kind of be like, yay, this is what we learned today. Why is it important? And what are we going to be doing tomorrow? And what are we doing after that? So that's really what I'm going to be talking about, which means that you will likely get out of here a little early because it's been like a long day. You know, it's a pretty heavy topic, long day. Everyone's a little tired. So we're going to talk about where we've been, where we're going, where we are and where we're going. So first, and we're doing a little live audience participation. I just kind of want to know, like, why are we here? Why are you here in this room?
My boss made me.
Hey, you know, that's a real reason, and it's an important one. We'll get to it later. Why is anyone else here?
Resources.
So we're about resources?
Networking.
Networking. All right. So this is me. It's my face really big. So I'm here for a few reasons. Like I said, I already think substance use is one of the most important things that a community can talk about. On the far right, that's me, and my mom, and my grandparents. I am someone who came from a household with a lot of substance use and mental behavioral health challenges. I will say I was incredibly loved, and I was really lucky in some ways that I could feel that love. I knew that love. There were other supportive adults in my life who could kind of help buffer me. But my family experienced homelessness multiple times. There were multiple times I didn't know where my food was going to come from. I still sometimes am a little guarded with my food. I don't really like sharing my French fries. Trying to get over that. But, you know, I experienced a lot of that trauma, a lot of that pain. I saw my parent have struggled with substance use. I saw them not be able to get out of bed. I had to be the one to call the emergency department or emergency services. So very experienced with that. And as a teenager, dealing with all of those emotional challenges that regular teens go through, compounded by what I was experiencing in my life, I used substances. I drank early. I used my mom's pills. I overdosed. So had a lot of experience with it. Again, was really buffered, had great community that still was like, hey, we're here for you, we see what's going on, we support you, and we support your mom, and we support your family. So I was really fortunate, not everyone has that. And I was able to graduate high school, again, not everyone has that. Somehow made it through college, wasn't the easiest, I will tell you that I have been arrested. So yeah, being very vulnerable and real with y'all. So I have gone through a lot. That happens. And I'm still here in the world that I'm in today, right? Sometimes I get some imposter syndrome. I'm like, I don't know, is this the right place for me? I don't know. And I think it absolutely is. Because we all have that lived experience. And it's that experience that drives our passion, that drives our knowledge, and that changes our systems. And so everyone in this room, maybe you didn't experience what I experienced. Maybe you experienced more. Maybe it looks different. But we're all here because substance use touches us in one way or another. Either you're the one who has used substances or misused substances. Maybe you're using it maybe someone's using it to hide their pain, to run away from something, to feel better. Maybe they were using substances because they got in a terrible car accident and were in physical pain, and it was addictive, and their brain changed, and they don't know how to stop. Maybe it's someone that you work with. Maybe it's a family member, a friend, or maybe it is just a client, someone that you're trying to help. But substance use impacts all of us. And when someone overdoses, it's not just their life, right? No, it's the lives of their friends, their family, their community. So that's why I'm here. This group up to the right, don't worry, I got permission to use their photo, was a group of kids that I've worked with. Juvenile justice and child welfare involved, mental behavioral health concerns, a lot of substance use. I do it now, not just because of the little girl I was over there with my family, not just because of who I am now and what my role is, but because I care about those kids. And I want them to have the same support and trajectory and see the same hope for the future that I was able to have. So that's why I'm here. And I think all of us are here because we all help people. We all are engaged in this work in one way or another, and we want to know how to make a bigger impact. We want to know how to see our communities thrive. We want to know how to help our neighbors and our families and our friends. So, bet you didn't know I was going to get into that when I asked why we were out here. But I did. Why does it matter? Like I said, it impacts us all. And it impacts people, it impacts our economy, it impacts our friendships, our lives. It's huge. It matters. We shared some of this data. It looked a little bit different, but our last presenter shared this data about the trends, right? Really exciting to see that for the first time in a really long time, we're seeing such a dramatic decrease in overdose and drug-related overdose fatalities. This is amazing. And the different colors, I know it's kind of hard to see, especially from the back, but basically the different lines are different colors. We're seeing a decrease in pretty much all of them. That top line, that black top line, that's going to be your opioids. And then the green line is our natural or semi-synthetic opioids, but the top line is opioids in general. That's amazing. And we're like, okay, cool, United States, but what about Colorado? It's been a little rockier, but we're still seeing this decline. Really important, because we haven't for so long. So I think we're doing something right. No one really knows exactly what it is. There are a bunch of contributing factors that might be a part of it. A big one, as we talked about, is naloxone or access to it, right? If we can prevent overdose fatalities, that's huge. But also if we reduce the stigma so that people can talk about their substance use concerns, get access to treatment and services, then maybe we'll also see that reduction. So this is great. Great. But we also know that that trend looks different, not just for different regions within Colorado, right? Looks different depending on where you are. It also looks different for different populations, different people. So we know youth are more impacted. We actually haven't seen the same decline. We've seen some, but not the same. We also, though, have seen that for different racial and ethnic groups, this is not the same. we have seen that for our Hispanic populations, there has not been the same decline. It's actually remained pretty flat. For our populations that are identified as Black or Black non-Hispanic, that has increased. So we ask why that is. And I'm not here to tell you exactly why that is, but it's something for us to be aware of. This is amazing, and there is still a lot of work to do. Because, right, this is not zero. And this is higher depending on who you are, depending on the group of people that you are in. So we have work to do, not to be a downer. So what's next? Well, a couple things. There's a lot of words on this slide. You don't have to memorize them. This is really just for me to kind of recognize. But I think it's really important to reiterate that substance use disorders really are a disease of the brain. This is scientific. So people, are like, name it, but no. Over the last couple of years, neuroscience has proven that over time, as we use substances, our brain chemistry changes. The neural pathways change, how you think, how you respond, your impulse control, all of your reasoning skills, all of that starts to change. Your memory, your anger, all of that starts to change because your brain is changing. So it stands to reason, right? It's going to take time. It's harder to just say, well, just stop using substances. They must not care about their health. They must not care about their kids. That's not true. And I think you heard from a lot of people today with lived experience that it is a struggle. People want to stop using substances, and it's hard because there are those brain changes and there are a lot of other factors at play. Another common misconception and myth is that, a parent with substance use concerns can just stop using. Not only is your brain changing, but how scary is it to admit that you need help? And how hard is it to change? So this is a different kind of thing, but have you ever said, okay, I'm really gonna reduce the amount of sugar I'm eating. I'm not gonna eat that cookie. But then the next week you do. And that seems small, because right, it's just like a cookie. Or, I really need to decrease my social media use. I need to stop doom scrolling on Instagram or whatever. And then you kind of want to reach for your phone because it's just there. And that's something small, right? So think about substance use. Coffee. I love coffee. I don't know what happened. So it's difficult. And then also, if we think about asking for help, and especially in small communities, right? We know each other. And if I see Joe's car in a specific parking lot, I know why they're there. And that is terrifying because I know people have stigma and labels associated with that. Oh, they must be there because they need treatment for their substance use disorder. Wow, I wonder what kind of substances they're using. Oh, are they a good parent? What's wrong with them? There's a lot of stories that we start to develop. So there's a lot of concerns, and especially if we start talking about relapse rates. Just like doom scrolling on Instagram, just like some of these other things, sometimes there is still return to use. It's actually a very normal process of the recovery timeline because, again, recovery is hard. And it happens. But if we stigmatize it and we say, okay, well, I don't know, they started using substances again, or they had an issue, they relapsed, they returned to use, I'm just going to give up on them because they clearly don't care. God, that sucks, right? I made a mistake and it was hard. My brain is different. I feel like everyone's watching me, everyone's judging me, and I made a mistake. And none of us are perfect. So that stigma is really important to think about and how our return to use is very similar to diabetes or hypertension. We also know that folks have thought for a while that maybe professionals can't successfully manage or treat substance use or co-occurring issues. Now that we know so much, our science has progressed. It's progressed a lot. Our ability to treat things in an evidence-based way has grown. And so I think it's more of a matter of getting those services in a community, which I know is part of why we're here today, right? We can learn about what evidence-based services are. Great, they're expensive. 2, what if they're not here, what do we do? So we're gonna talk about that a little bit more, but I think it's really important to kind of set some of the groundwork, and that's part of why we're here. It's not just to network, it's not just to figure out resources, but it's to build that common ground and common understanding first. Because if we're talking about different things, then how are we gonna make an impact together? So what do we do, right? That's the thing. What do we do? As a community, these are kind of the 4 tenets of how do we address substance use disorder treatment. There's these 4 pillars: prevention, harm reduction, treatment, recovery. We're gonna dive into some of these pieces. You've heard from folks, some of the presentations that go into prevention, harm reduction, treatment, and recovery. Tomorrow, we're gonna dive even further into it. Your first presenter tomorrow is from the BHA. He's gonna go even more into depth about like, what is opioid use disorder? What does it look like in the brain? What are evidence-based treatments? And how has current Colorado policy recently changed to expand access to treatment and services, and how can we grow those treatment and services in the community? So we're gonna hear a little bit more about that, which I think is really important. Harm reduction, that's where we're talking about stigma reduction, increasing access to naloxone and other harm reduction techniques, so fentanyl test strips, talking about stigma, wrapping around our families, because if families are too scared to even get a little bit of help because they have to be perfect to get all the help, man, right? Like, what's the saying? And I hate it because I don't ever want to eat an elephant, but like, you know, how do you eat an elephant? 1 bite at a time. It's a terrible saying, but that's the thing. We got to break it down to something manageable. So we're going to talk a bit about harm reduction. We're going to talk about evidence-based treatment services. How do we expand those in the community? And then we're going to talk about recovery. I think recovery is one of the biggest things that we can talk about because folks are like, oh, well, you're done using services. Now you're in recovery. Okay. But there's actually really great things that we can do to support people who have in their recovery journey, whether that's housing, other activities where they aren't feeling the temptation as much to use substances. So these are kind of the 4 pillars that each community needs to tackle and make their own. And we're going to talk a little bit more about it tomorrow, about what some of the things are under each of these pillars. This is a graphic. So there's things that we can do. I'm going to go here for a second. There's prevention, harm reduction, treatment, and recovery. There are things that we can do at the systemic policy level. So we talked about that, right? What can happen from child welfare or judicial, public health? What are the partnerships like there? But then there's things we can do at our community level. What do we do around these things when we're talking to our community members, our neighbors, our friends? There's even things we can do in our businesses. So recognizing that people in recovery may be involved in probation, may need to do a UA or like a urine analysis, drug testing. They may need to go and get their treatment. What is the flexibility we have for someone to be like, okay, yeah, go ahead, go like take your 30 minutes, go get your treatment and come back? Like, what do we do as a community and as employers to support people who are in recovery? So there's things that we can do there. And then there's things that we can do as family and friends. How do we talk to people who are experiencing substance misuse concerns, substance abuse? How do we wrap around them? How do we wrap around their kids? Is it having naloxone in your purse? Is it, talking with your neighbor? Is it having it in your apartment complex, at your school? Is it as a caseworker, making sure that you're giving it to all families, just in case? Because I'll say we have seen that there are times where infants are being brought to the emergency department because they're overdosing on fentanyl. It wasn't that they got a hold of like a parent's fentanyl. They were being babysat by their grandparents. Their grandparents dropped one of their prescription medications. It was under a couch, the little kid was crawling around and popped it in their mouth. Right? These things happen. And I'm not trying to say this in a way that's like, oh, be afraid, this is everywhere, it's terrible. No, it's not that. But if we talk about it, if we give people tools and resources and we stop stigmatizing it, then wow, how much more potential do we have to save a life and to keep a family intact? So I will say that, well, the particular instance I'm thinking of, they did have naloxone and the baby did go to the emergency department, but was okay. So this graphic just shows how our different systems can come together in our communities to address opioid use or substance use disorder. And these are just some key things, right? So at the policy system level, what is our shared mission, vision, and goals? That sounds really goofy, okay, we're gonna make a strategic plan, we're gonna be this is really let's talk about it. Again, get a common understanding. Are we committed to this? And by this, what do I mean? Are we trying to reduce opioid use? Are we trying to address opioid use disorder? Are we trying to reduce fatalities, reduce overdose? What do we mean by we want to address substance use or opioids in our community? That's not for me to decide. That's for you all to decide. For you all to have these conversations and to talk about. What are we trying to do? What's our goal? And it can look different over time. What's our goal in the next year? We just want naloxone everywhere. We want to see a decrease in deaths. We want to see a decrease in fatalities. Then in 2 years, maybe that shifts. But it's coming together and having that agreed upon vision and approach. Cross-system communication, again, really important. I'm pretty sure all of you have encountered that frustration when there's an administrative burden of oh, I have to get this form filled out by that person and to get this data or to have this conversation. And there's all this red tape and there's these barriers and it takes way more time than it should and it's frustrating and people have these egos. I'm not gonna lie, I have an ego too, but egos, right? And people are fighting over resources. But what if we figure out a way to share our funding, rate our funding, and break down some of this administrative burden and these barriers? There are ways to do that. And I know that can seem daunting, but at the same time, these are all policies and laws and rules that were written by us, by people. They can change, they have changed. I think I was having a great conversation earlier and it's about how are we gonna think outside of the box? Because we can. So how do we talk about it? How do we communicate together? The other piece is this ongoing cross-training and staff development, what you guys are doing here today, right? Let's get a basic understanding of what we're talking about. Let's get a shared understanding and let's do it more than once because things change. We learn a lot, not just in this room, not just in this community, not just in this state, but things are rapidly changing in what we know about how to effectively address substance use concerns, especially opioid use disorder. You can tell that just by, this kind of stark drop. We've learned a lot. So this ongoing education and staff development is really important. And then at the center is what we do for our families, right? We identify the issues early, that's that prevention piece. This is a family-centered approach because that's my world, but we listen to the people who are impacted by this because they know what they need. They say, this actually isn't helpful, or this is helpful. I've heard a lot from people I talked to a lot of parents and did a survey, and a lot of folks were you know what? It's just hard. I have a job and I have rent, and if I'm gonna go into residential treatment, what happens to my kids? What happens to my house? What happens to my job? Gosh, if I go get inpatient residential treatment, I can't work, which means I can't pay for my rent and I can't pay for my kids, and then I'm gonna lose them, right? There's this spiral. So how do we talk to people about what they need, center them in our solutions, work with them to develop solutions, and then go from there. The other piece is that equitable, timely access to assessment and treatment services. I think that goes without saying, right? We know that. Get people connected to the services they need in a timely manner. Way easier said than done, especially if services don't exist. I get it. So here we talk, this is kind of duplicative. I just went through all of these just now, including collaboration and barrier busting, right? I can't necessarily stand here, and maybe in the future I can, but your community's needs are your community's needs. They are not the same as Denver metro area, you know that. We heard people earlier today talking about Western Slope. We know Western Slope is different. You all identify what your needs are and then work together to figure out those barriers. Obviously, you can't do that on your own, right? We need funding here. We need services. We need support. So there is more collaboration and barrier busting that needs to happen from here up to the state, 100%. And I am hopeful that this is the start of that. But want to say we recognize that too. So what's next? Obviously this is not what's next because this was today, but this is what you talked about today, right? So what's the impact of drug misuse and abuse, particularly opioids? What are the services that are funded and upcoming changes to how that's going to be expanded here in the community? So, right, you heard from Lynn, then you heard from the regional accountable entities or the RAIs and the MSOs. I know that was kind of a dry presentation, but they are the folks who are the payers. They pay for the services, but they're also supposed to help ensure that whole continuum of services. And so there's more that's happening there. I really encourage you all to go to some of these community sessions and to also talk to your local government to make sure that they are advocating for your community, right? So the other part you heard was the importance of peers. It is hard, teenagers, right? I've been a teenager. I've been kind of a troublesome teenager. I go to a teenager today and I try and be like, yeah, I've been there. They're like, you're a little old. If I was a little closer, maybe there'd be a little bit more there. But if someone who hasn't been through any of that then tries to talk to my teens, there's a huge disconnect, right? There is a power of being like, I have been where you are. I have had to navigate these systems. I have had to navigate these nasty looks. I've had to figure out these treatments and which medication works for me versus which group. Here, and I'm here to walk through this with you. There's some things that caseworkers can't do. There's some things that probation officers can't do. But there is a power in having someone walk next to you and with you through that fire who's already been through that fire. Because there's also hope. It's well, they made it. I can maybe make it too. So peers are really powerful. They're also, and we've already talked about this, I think they explained it way better than I ever could, but they also are a great bridge for us as people in systems, right? To get that trust, to get that buy-in, but also to hear from them. Because, I hold a position of power. I work for a very scary system. I am a white, cisgendered person working for a very scary system. It is scary for them to talk to me about their substance use because of that power that I hold. So sometimes I need to lean on my peers that I've developed a trusting relationship with to say, hey, what am I missing? What's my blind spot? How can I be more helpful? What services are needed? Because those peers are able to get that information in a much more honest way than I necessarily can. So really important there in your community to leverage that. And then harm reduction and stigma, again, you guys heard about that. Again, a super important thing just to think about because this might be really blunt, but someone who is dead can't enter recovery, right? They can't. And the person who overdoses and dies of a fatal overdose, it's not just that person who's impacted. it's the person who finds them. It's the person who finds them. It may be a first responder. It may be a caseworker. It may be the coffee person who's cleaning the bathroom at a Starbucks, right? We don't know. It impacts the family. It impacts their kid. It impacts their friend. It impacts the healthcare provider who tried to resuscitate them. So an overdose impacts a lot of people. But if we can have naloxone on hand, have it available, have fentanyl strips around, those are powerful tools, not just to prevent that individual person's death, but to prevent the trauma that ripples out into our community. So tomorrow, we are going to have some great speakers. Our first one in the morning, we're going to be learning about opioid use disorder, as I mentioned, modern treatment and medication access in Colorado. Bryan is a super engaging presenter, incredibly knowledgeable, and he is really designing his presentation to also hear back from you. So he works at the state, he's at the Behavioral Health Authority, BHA. Sometimes it's hard not to talk in alphabet soup. He works at but that's where he works. And he also really wants to hear from you all what is missing. Because his role is to figure out how to better support opioid treatment across Colorado. So he is actually going to be asking for some participation, so heads up, because he wants to hear from you all too. Not just say what he can do or what he has done or what there is, but to then really hear what is needed in this community. So then the next presentation is exploring the landscape of substance use with our 3rd Judicial District. So there's a couple pieces here. One, we will be hearing from folks on our court system itself. So what are some of the trends that we're seeing? What are some of the best practices that are being implemented? And what are some ways that the community can support these best practices for individuals who are involved with our courts and also have substance use concerns? We're also going to hear from probation about some really cool things that they're doing from probation and from our law enforcement and our jails, actually. So the whole judicial side of things is getting pulled in, and you're going to hear about some awesome things that they are all doing, but also trends that they're seeing and ways that the community can support their teams and their projects and the people who are in them. We're also going to talk about the unique treatment needs of adolescents, as well as pregnant and parenting people. This is really important because, right, no two people are the same, but these are two very different populations for a couple of reasons. One, their brains are changing. I did not know that pregnancy brain was a real thing from like a neurological perspective, but it is. Your brain actually physically changes. And how those changes interact with opioids is super unique. So we'll be talking about those unique treatment needs and approaches. And then at the end of the day, I know it's going to be another marathon, guys, but at the end of the day, we're going to be having a roundtable with some community leaders from different sectors and systems where we're going to talk about current challenges that are being experienced across sectors within the community, but then also opportunities, one, for them all to collaborate and support the work in the community, but also ways that the community can also support the work that's happening across systems. So that's tomorrow. And after. You'll notice I don't have bullet points here, because a lot of that depends on you. We're really hoping, right, that this is the first of many steps in the future to building momentum and a collaborative process for, yes, getting that increased understanding and common mission, blah, 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 around how to address opioids in the community, but then to continue to have that conversation. What's working? What's not working? How can we better support each other? What funding is available? How can we share our funding? Because in reality, substance use is a big thing. Opioid use disorder is a big thing. It is too big for one agency to tackle on its own. We all are in it together, and we need to figure out how to play together. So yeah, that's the after. And the state is here to, help as we can. I'm here to throw a good party. But really, it's up to you guys to really start coming together and to continue the momentum. So that's it. You guys get out early.
All right, folks, before we disconnect from the online platform and send you out the door, just a couple of logistical pieces. For those that are online, please watch out this evening for an email from myself with our day 2 access link for the presentations tomorrow. Follow up to today, we'll also be getting out all of the handouts and slide decks that were presented to throughout the day to everyone online and here. And then, of course, we will start a little bit later tomorrow, so there will be no 7 a.m. call for you all. We will start at 8:45 with opening remarks. So please come anytime between 8 and 8:45. We'll have breakfast again for those that are here in person, and we will also serve lunch. So again, thank you all so much. For the folks online, thank you, and we will see you all tomorrow.